Hello, welcome to our last community meeting for the calendar year. Um, Within our first couple, I was asking some people and some parents what type of topics we'd be looking into, and I got a couple responses back and looking a little bit more into brain injury from a couple lenses. Like one is like, what's our history with brain injury? Have we worked with brain injury? What does that look like? How does it differ from learning disability? How would the interventions differ? I think like if you've seen one brain injury, you've seen one brain injury, and every brain injury is different. The same thing with learning disability. I know just because there's a certain diagnosis doesn't mean that all the behaviors line up for that exact diagnosis across the board. Everyone still has their unique abilities. Another question is like, what do I do if I have a concussion or my child has a concussion? What are the procedures I should be following? So I wanted to dive into a couple of this, and I thought a perfect person to invite here to join for today's meeting is Sean Porter. And Sean is from ABI Wellness, where they have the Bears program. I'll let Sean kind of introduce himself a bit here. We'll chat back and forth as usual. But welcome, Sean, to our presentation today. Thank you for joining us. And yeah, why don't you introduce yourself and let us know what you do and where you're from.
Perfect. Thanks, Josh. Happy to be here. So as Josh said, my name is Sean Porter. I'm the CEO at ABI Wellness. My background is as a neuroscientist. I've done research on Parkinson's disease and then moved into more concussion due to personal background and just overall interest. And so did research on adolescent concussion recovery, and then got introduced to Barbara Aerosmith, Howard Eaton, Mark Watson, and the work being done with kids with learning disabilities, and they approached the lab that I was working in at University of British Columbia to explore the impact this kind of program could have on brain injury. I've known about Barbara's work for a long time. I read Norman Doidge's book when I was in my undergrad, and it was quite I find it quite humorous that, years later I got to actually meet her and be involved in the work. And so I'm focused on bringing this type of neuroplastic care that you're all familiar with learning disability, and bringing it into healthcare, where surprisingly it's not as far advanced as we'd like it to be. And there's a lot of gaps in care that continue to exist, and people not getting quality rehabilitation and the opportunity to recover that we would like them to see. And so myself and the team at ABI Wellness are really striving to get this program available across Canada, but also beyond into North America and around the world, so that everybody who has any type of cognitive issue due to concussion or brain injury or illness has the opportunity to live with a high level of quality of life and just better outcomes overall.
So this is a little background about how we got together. Sean put this little cap on me,
Very flattering photo.
yeah, as we were moving through the initial stages of research. But Sean and I actually met in, I believe it was a boardroom, but the next step was coming into Eaton Aerosmith School to try out some of the activities. And I remember the complexity of some of the activities being like shocking, but I could see the wheels turning on how this could apply to rehab in Sean's.
I lost you there for a sec, Josh.
Can you hear me now?
Yes.
Okay. So I remember having, sorry about that. I remember seeing those wheels really turning with Sean at that point. So we started our research project, and EEG was something we kind of threw in at the last minute to see, and we saw massive outcomes with understanding and reading the electrical activity between the hemispheres, and seeing, if I remember correctly, and you can speak to this a bit, the connectivity was overstimulated within the prefrontal cortex.
Yeah, yeah,
Yeah.
that's right. Yeah,
So we ended up seeing big success within the profile, the study, and that led to the start of the Watson Center Society for Brain Health, where I switched over from the research portion. The all the research that came out helped to spur on the development of ABI wellness. And upon graduation, Sean joined ABI Wellness to work with them to get this really off the ground and start to look at that from a clinical approach within healthcare, using the Aerosmith program, and
yeah.
with a few
It
other.
was it was a really amazing opportunity to be involved in a research project that had such tangible outcomes. So oftentimes in research, you get to do a research project and then you do the result, you write up the paper and then you shelve it and move on to the next study. And because of the way that we'd set up the study, it was all at the Javed Mofajian Center for Brain Health at UBC. And so I had my lab, and it was just down the hall was Josh and the participants who were doing the study. And I got to actually meet and interact with these clients and see the impact that this program could have. And some of the researchers who were on the that were involved didn't think that people with brain injury could engage in a program like this. And so the first test was really to see, would people even show up, and would people engage with Josh in the program? And then secondly, what kind of outcomes would we see? And amazingly, we saw absolutely incredible engagement, much better than you typically expect in research in general, but especially with research with brain injury. And then the feedback from the clients and the outcomes were just amazing. We were told that it was like winning the lottery. And when, as Josh said, when we saw the changes in the EEG looking at the connectivity, it was just not something that you typically see in this population with this type of a program. And so it's like, okay, we really are onto something special here, and we really need to move this forward. And I was really inspired by Josh and the team, and taking this directly and moving so quickly into clinical delivery with the Watson Center, because typically there's like a 10 to 15-year wait time between research and clinical application. And so being able to streamline that process and just get the work out there was really inspiring. And so when I graduated and was able to come in and be involved in that, I couldn't say no.
Yeah, the interesting thing about that study, looking back, and like really, it was the first time I'd ever seen research being done at that high level. I'm an educator by trade, so education doesn't have very much research. It should. There should be more research. There should be more collaboration within neurology and how education is formed. But I just remember seeing how often all of the researchers would just come by and like look in the window, because I think it was shocking for them to see people with brain injury actually engaging in programs from just an interest point of view, more so than like, yes, the science came out of it and it was like, it's backing up the engagement that we're seeing. And it was fun to kind of communicate with them and understand that, and working with Sean and really learning as much as we did just from working with the individuals and the researchers. But then it got to 3 months and we said, okay, well, we got to bump this up. We got to go to 6, then we got to go to 9 months. Josh, can you please go and talk to the participants and get them to stay? And it was interesting because going back to them and saying like, look, we're going to extend the study. You're welcome to stay. We would love for you all to stay. The response wasn't like, yeah, this is great, I'm feeling good, let's stay. It was, but I'm feeling better. Like, I've been out of work for 7 or 8 years. It's time for me to go back to work. I've got more energy. I've got more stamina. I've got more ability to understand concepts, and I'm a fluid thinker. And we're seeing all this in the research, so we understood like, yeah, that's great to hear because it's matching up what we're seeing in the quantitative data. But there was a really good sign to say like, we have something here that can really work in a world where there's not much hope or answers in the post-acute. So yeah, we were excited to really get moving at that point. Sean, I'll let you run through these ones.
Perfect. So just to frame the conversation, what is an ABI or an acquired brain injury? And so that's really any type of injury that you can think of. So whether it's TBI, a traumatic brain injury, a concussion, a stroke, an illness, anything that's really causing long-lasting symptoms or damage to the brain. And symptoms can include memory problems, personality changes, poor concentration, lack of behavioral and emotional control, among so many others. I mean, a new one that's recently come up in the work that we've been doing is long COVID. So a lot of individuals have brain fog and ongoing issues due to COVID-19. And so that is also now considered a brain injury as well. And so the question that ABI really brought into the medical side was how can physical therapy or other traditional medical services be paired with bears, and how can that help patients? So currently, the reason that we really went into this space was that the need is so high. So there are, I mean, this is American data, but the same thing is true in Canadian. Um, there are huge numbers of individuals who live with ongoing ABI related disability, particularly impacted by cognitive impairment. And so that's kind of that gap in care that Josh mentioned and that we really wanted to address here. And so what we proposed was that, the current strategies of OT, occupational therapy, physical therapy sessions, and often what's used is compensatory strategies will help get functional outcomes better. And so you can see this dotted recovery trajectory line. We'll see some initial improvements and then we'll reach this little plateau kind of midway through. And that can be good. You can have decent outcomes there, and you can, it's not terrible, but we thought that we could probably be better. And so the idea of combining those current strategies with bears and with the program that at EASO is we could get that improvement all the way back up to here, which would be and that's through adding in that focused evidence-based cognitive care, interdisciplinary model with exercise and mindfulness, and with the live tracking and active rehab and patient intervention. And so that's really the mission and vision with ABI Wellness, is really to maximize the potential of functional recovery that we can get out of people through the brain's natural ability to change and to recover. And so the key aspect of that was active cog rehab. And so that's something that's typically not used. So I mentioned kind of the bottom part of that last slide was compensatory strategies. And so that's often what's done, especially on the cognitive side. On physical rehab, the medical world is pretty good. If you have a bad knee, you have a bad back, you have other physical limitations, they'll do surgery, they'll do physical rehab in order to get you back to function. They're not going to give you a crutch or give you a knee brace and say, see you later, you're at 60% of function, that's probably good enough. They really work hard to get you back as close as possible to 100%. On the cognitive side, it's kind of still a area of unknowns. And so they don't really know what to do with people, and they don't have tools to do anything effectively. And it's kind of it's clinician dependent based off of their experience and who taught them. And so as a patient, that is very worrisome, because the quality of care that I'm going to get is going to vary so greatly depending on who I happen to see. And so those compensatory strategies are, use sticky notes if you have bad memory, use phone apps to help schedule your day so that you stay on top of your tasks. And pace yourself so you're not over pushing what you're capable of doing right now. And all those things are useful, but they're limiting, and they don't allow someone to grow and to move beyond those initial limitations that they're seeing. And so with active cog rehab, you're looking to move beyond strategies to capacity building. And that's all about what EASO is about, is really with the kids is, improving cognitive capacity. And so we want to bring that approach to brain injury. And so by training the brain, we know the brain's neuroplastic, we know it can recover and rewire. And so if we can provide targeted exercises that address issues that have been impacted by the brain injury, we would then be able to see improved cognitive function, which would then transfer into improved quality of life, improve someone's ability to go back to school or go back to work or whatever activities are important for them. And so that's really the novel aspect of what BEARS is providing, is that standardized approach to cog rehab that's currently missing.
And we see this a lot in learning disability as well. Like as soon as the IEP is established within the school or the diagnosis, there's certain things that are taken away and other things added in. So like difficult things in school are taken away, and let's say tutoring's added in, or different compensations and different strategies that are added in. But really the brain needs to be in a healthy place and needs capacity to be able to hold on to a lot of these tricks and tools. And the tricks and tools are fabulous and they're needed. But when the brain can't hold on to that, there's a time and a place when it's the most successful. So often putting this type of work before adding in those strategies, you get the best of both worlds because the brain's in a better place to actually employ them. Whereas, using those things before, they'll only get you to a certain point, such as this graph here. They only get you to a certain point where you do need to get to that next level, and to get to that next level, adding in some functionality and capacity within the regions associated with learning are so important.
Yeah, it's a good point, Josh. The compensatory strategies do have their place and they are helpful. So we don't want to completely disregard those. But again, as you said, let's improve capacity first and then rely on those afterwards and better utilize them. And so when we think about a cognitive program that's really targeted and not just doing, oftentimes if someone's had a stroke or persistent cognitive issues with injury, they'll say, oh, do some brain games or do, Sudoku or those types of things. And we know that what's really needed is targeted cognitive programs, things that will provide differential stimulation, require effortful processing, that stimulate the right areas of the brain in a structured way that will actually lead to something. And so with BEARS and with BrainX and Aerosmith and all these programs, they provide that structured, targeted programming that leads to this functional change in the brain that we were talking about, that reorganization of the prefrontal cortex, the increased connectivity, the reduction of the extra connections that are often present following a concussion. And this leads then to increasing cognitive capacity and the ability to learn, which helps with school, career success, but also almost as importantly, or just as importantly, increased social and emotional well-being, allowing individuals to maintain and strengthen their interpersonal relationships and be able to build a meaningful life with their loved ones and their community. So what exactly is the BEARS program? So I've talked about BEARS, talked about ABL Wellness, but BEARS stands for Brain Enhancement Recovery System. And so it brings together the best of evidence of a variety of different areas within brain recovery. And so it combines aerobic exercise, targeted cognitive training, mindfulness, and progress tracking all into one platform, so to create a more holistic care program. And so the first part is aerobic exercise or cardio. And so aerobic exercise is shown to improve neuroplasticity and cognitive performance. It also releases a variety of proteins in the brain that help drive neuroplasticity and neural growth. And so by priming the brain with exercise, we're able to enhance the outcomes of the intensive cognitive training that we're then having the clients do. In addition to that, a lot of individuals following injury have a variety of orthopedic and physical issues. And so by adding in and tracking regular exercise, we see a lot of physical transformations that coincide with the cognitive transformations that we're looking to occur.
I remember we added this in too, because this was not a part of our first study.
It was not.
Yeah. And in the subsequent study, we added this in, which was a smaller N, I believe. There was less people involved within that study. But as soon as we added in cardio before, when we were doing it more strategically, the outcomes were so much faster when the brain was those healthy chemicals and proteins. And it was almost tangible in terms of like working with clients through Watson Center at that time. And we do recommend and suggest and have presentations on the benefits of cardio and the benefits of exercise. And I think it's almost like cliche to say that, but when it's structured in well, we would love to be able to put this into our programs at EASO. It's just difficult in terms of being in so many places at once with so many students at once and having the time to put that in, because EASO really is more of a triage approach where we're choosing the most important activity or two activities to work on, and you're not there for as long as some of these clients might have been there from. But if there's a really good takeaway for the learning disability population just wanting to learn a bit more about brain injury here, is structured exercise before working on your cognitive exercise with us can really benefit. Sean, can you go into a little detail about like heart rate zones that we'd be looking for, or time, how much time to engage before? Because there's definitely too much. Like you wouldn't run a marathon before doing
No, it's kind of a sweet spot that you want to exercise for. So the research shows that about 20 minutes of moderate intensity exercise is kind of what you're looking for. And that will vary. What moderate intensity exercise varies depending on your age, your fitness level. But you shouldn't, if let's say you're jogging on a treadmill, moderate intensity, you shouldn't be able to have like a very easy conversation. You should be able to talk still, but you're breathing a little hard. It should be hard exercise. And we're looking for 20 minutes because what that shows is that leads to the optimal amount of increased blood flow to the brain, the optimal release of something called brain-derived neurotrophic factor, which is that kind of, we call it miracle grow for the brain. And so that helps with the neuroplasticity. If you do too much, as Josh said, you're going to enter into a level of fatigue that's going to detract from your ability to then engage in the exercise. And then if you don't do enough, it's not going to have enough of that release. It's not going to cause the kind of outcomes they were looking for. So just going for a walk around, a light walk around the block is better than no exercise, but you're not going to get as much benefit as you might if you did the moderate intensity. And the key thing in this space is really, anything is better than nothing. And so we do want you to exercise. We do before, and ideally you can get to the moderate intensity, but if you can't, that's okay as well. Just start moving, and then over time you can build that up. So cognitive training is something that I think all of us here are familiar with. So Bears uses, we used to use a larger set of exercises, but we really moved towards only using symbol relations. We do find that exercise in particular with brain injury is particularly powerful and particularly transfers well across into other areas of cognition and, most importantly, quality of life and real world outcomes. There are huge benefits of these other exercises. The symbol thinking, nonverbal thinking, predicative speech. In best case scenario, we would definitely include all of these and probably more. But in the medical world, we're constantly faced with constraints around insurance funding, engagement time, the ability for clients to engage because they're often struggling and trying to get back to work or whatever their situation is. And so we have to, as Josh said, triage and use the best exercises as possible. And so that's why we've really targeted on the symbol relations exercise. And as you know, it improves, higher order cognitive functions, attention, concentration, memory, and so much more beyond that. And so we find it really the best tool available to improve these functions. So then mindfulness curriculum is another thing that was added in later. So again, the first study was really just cognitive training. And then in the second study, we added in aerobic exercise and the mindfulness. And we did this because the feedback from some of the experts and some of the clinicians was you really need to build a more holistic one-shot tool to improve outcomes. And so meditation has so many recorded benefits in healthy individuals, but also in brain injury. And so by incorporating a regular practice in a regular practice of mindfulness, we're able to see improvements in self-awareness, concentration, attentional control, and emotional regulation. And in particular, emotional regulation is a great one to have when you're doing clocks because a lot of clocks can lead to a lot of frustration. And if you have poor emotional regulation, you're going to have a lot of outbursts and a lot of with all that pent up frustration. And so by incorporating this regular meditation, it provided tools for those clients to use outside of the meditation time for when they were really getting frustrated at the clocks exercise.
Yeah, where I found this kind of relates back into clocks too, is clocks really is helping us have that communication from hemisphere to hemisphere through the corpus callosum and lowering the amount of noise there. What mindfulness really does is allow you to be more in that moment. So it helps to enhance the ability to stay in the moment, really focus on the body and the breath, which is helping aid clocks because clocks is doing a similar thing by not having us think too much in the future, which can cause anxiety, dwell on the past, which can cause depression, and really keeping us in that moment. So mindfulness was an awesome addition, I found, and very welcomed. Like I remember um, the times when we didn't have mindfulness center, we were just getting it into the system. We would have full tour groups coming through in the early days of Watson Center. We would do okay, like a part of the day is now we're going to do our meditation. And I remember one family when I'd have my eyes closed because I'm leading this meditation, and then I open up and look, and this one kid and his dad was just like staring at me with their head sideways, shaking their head like this is not our jam. This is not what we do. And flash forward a year later, this kid was one of the best meditators I've ever seen. His outcomes were phenomenal. I think he's a forest firefighter now, like living his dream. He's recovered from his brain injury. But working from that, like this really isn't for me, realizing that, okay, this has massive health benefits for me that I'm noticing, to employing that in his life, to now staged out and fully recovered and back as a someone who is really contributing well to his environment and his life, which was his biggest goal. So seeing how something as simple as just being in the moment can help add to a program like this is awesome.
So the last part of the last pillar, I guess, of the program is really this real-time progress tracking. So this is something that's often missing in the medical system. A lot of it's pen and paper reporting, running record, and then that leads to a lot of missed opportunities in terms of not knowing exactly where your client is at, not being able to meet their needs in a timely manner, and also making it harder for dealing with the funders and dealing with other people involved in the care team. And so through the software, we have this live reporting and automated reports that can be generated that really show how a client's doing in real time, allowing the clinician to engage and adjust the program on the fly as needed to make sure that a client's getting as much out of the time they're spending in the rehab as possible. We don't want somebody spending hours waiting to hear back from a clinician or struggling on a level that's either too hard for them or not challenging enough, and then not getting the most out of it. And so this really helps with that aspect.
And this is one that we also share, a pillar that we share within
Yes.
EASO, where we are using data consistently in real time, especially in a classroom model where we're jumping back and forth and able to see real-time engagement. So this is such a game changer. This was added around 2017, 2018, I believe. So quite new. Everything was pencil and paper before that. And since adding this in, so much easier to work with students, and at the time with clients and patients at Watson too. While I
It's
was
also a
there.
great tool for the patient or the client themselves to be able to see how they're doing. And so it's not just being told how they're doing. They can see their own engagement. They can see their own progress, which is very motivating to keep going.
Yeah.
So who do we typically work with? So again, we license our software to clinicians. So we are available in almost every province now, and starting to branch out into the United States as well. And we typically work with physiotherapy clinics, hospitals, nonprofits, some gyms, some multidisciplinary clinics with occupational therapists, anywhere that you typically go to get some cog rehab following injury or illness. And so one really great testimonial of an individual who had multiple concussions, and she was really unable to go back to work because she was having a really hard time with sound, with impacting her ability to concentrate, really bad headaches, couldn't follow a conversation, especially if there are multiple individuals speaking. And she was working in a rehab facility and had tried all the standard recovery treatments and nothing was really working. And so she engaged in the platform with Josh, actually. She had an amazing recovery, was able to go back to work. And as she said, feel like herself and perform in that environment. So that's one example.
Not only did she go back to work, I believe she now runs like a very successful business as well.
Mm-hmm.
So able to progress and not being limited to just that recovery. But what did recovery, and I'm not saying we were the only thing that she was doing. She was definitely making sure she was hitting all her areas, but not just recovering to the point of going back, but advancing.
Yes.
And I saw that with the other example I gave with the mindfulness, and seeing people not just get back, but thrive after in their recovery.
This is just a different type of client. Someone who had a MTBI concussion, I believe, and that they were having a lot of that brain fog, processing speed, concentrating issues. And again, they were able to not only engage in the program, but see huge amounts of progress. They were able to go back to work in teaching elementary school, which we know is a very intensive job with lots of variables all over the place and lots to handle. And so being able to have that support from the Bears program and to challenge her brain in a way that was that needed that recovery was transformational. And as she said, the 4-pillar approach was what she needed to go back to teaching. And so we see that all over the place in new populations all the time. And so
Great.
how does it, oh, sorry, go ahead, Josh.
No, you can follow through. Go ahead.
So, and as Josh mentioned at the beginning, some of the individuals have come up to you asking about, what happens if they've had a concussion or if their kid has a concussion, what should they do about that? What are the treatment options? And so, the science shows that most people will recover on their own from a concussion. So we do recommend that everybody still go see their doctor, get checked out, make sure everything's okay. Take lots of rest, drink lots of water, start to reintegrate back into your regular activities, make sure you're exercising. It's really important not to, there used to be the recommended treatment of locking yourself away in a dark room, not engaging in anything until symptoms went away. And the research shows that's harmful. So that actually makes symptoms last longer and makes things worse for the overall recovery trajectory. So we want to recommend that you start to engage in a very slow graded way back into your regular activities, and listen to your body and listen to the symptoms that come up. So if something's bothering you, if you engage in something and it causes symptoms, pull back, rest, and then move forward again. But if your symptoms do persist, typically beyond the first 12 weeks, which is when we do expect the brain to recover on its own, if it persists beyond that, then Bears could be a good option for you to consider, especially if you're dealing with those ongoing cognitive issues, that brain fog, that ability to engage. Bears could be a good solution for you.
Yeah, it's interesting the way the brain tries to protect itself too after an injury, where sometimes we're much more capable than we think at doing something. I remember I was training for a marathon and I had a concussion a few years back, and my brain was telling me like only run 3 kilometers and then reevaluate. And I got lost running and I had to be somewhere. And I had to find my way back. I had to reorient myself on a map, which was kind of difficult at that time in the recovery. You'll find that many of us have been through concussions. I think it's quite normal now that people have had concussions, and hearing stories uh, about the recovery system. But anyway, I ended up running, I think it was 8 kilometers 13 kilometers that day, and I meant to run 3 or 4, and realized at the end, like, I've been protecting myself too much. And I think sometimes after a concussion, people think that, or after a brain injury, people think I need to protect myself at all costs. I can't get hurt again. I don't want to put myself in bad situations. But sometimes we don't really have the wherewithal to really understand what those limits are. That's where the health tracking is really helpful. And the safety net of being in a system and a program where you're able to start to push those boundaries, get some data on that, and know that you're in a safe place. So it's interesting that how the brain does that, and it is kind of an amygdala response to say, like, nope, don't want to hurt yourself, make sure you slow down, and just protecting in your fight or flight system comes in to do that. But sometimes we do need to see how much can we push ourselves now. Like Sean said, like sitting in a dark basement recovering isn't really helping. Running a marathon the next day isn't helping either. So there is that fine balance as you're going through that recovery. And within Eden Aerosmith, like when brain injury students started to call, and families started to call to see, like, hey, can you work with us? We really didn't know at the start if we could. And we would have families sign off on what we were doing, saying, this may not work. We acknowledge that this may not work. However, we are willing to try it. And we saw awesome recovery with these individuals, and that kind of led on to the idea of, like, let's see if this works within controlled research. So with that, I do want to announce that EASO will be adding in ABI wellness in the Bears program in 2024. We're looking to, with our experience within the cognitive world, we are looking to bring this in. We're quite confident that we can help with the recovery with a lot of individuals out there. Many of you know people with different types of, doesn't have to be just a car accident or a concussion. What other types of illnesses do you guys treat in with bears, including like aging brain? What other areas do you focus on?
So that's a great question. And we're really excited about this partnership with EASO and being able to add this into the offerings that you have and the expertise that you guys already have in the space. And typically, so initially we thought this was really only applicable for a concussion. And then, okay, looks like it's actually beneficial for TBI. And then we branched it out into stroke. And so now what we're seeing, thanks to the clinical partners that we work with, we're now working with individuals who are concussion, TBI, stroke, long COVID, so brain fog or other illnesses that are causing that brain fog experience. We work with individuals who are undergoing chemo, who are post-cancer or active cancer, PTSD. We work with individuals who have depression or anxiety. All of the and then, as well as you mentioned, aging brain. So looking to prevent cognitive decline or working to hopefully maintain, a level of cognition after noticing a level of decline. And so really anybody who's had some cognitive dysfunction or noticing some cognitive change can really benefit from bears and structured cognitive training.
Yeah, so we're hoping to bring this in kind of an independent like model, like we have with our clocks program with the independent model. We're looking around February, hoping for February. And we are happy to take calls if you know anyone in regards to like family or friends that might really benefit from this work. This is where to reach us. Sean can be reached in terms of finding certain clinics, in-person clinics, and just pointing you in the right direction for where the best place would be. And I would be the right person to contact if you're interested in ABI Bears at EASO. And yeah, we're looking forward to adding this in. I'd like to thank Sean for joining. I think the last time we presented together was at Vancouver General Hospital.
I think so, yeah.
2019 to a
yeah.
big group of paramedical professionals learning about what we do. And it's great to present again with you and share some knowledge. And I'm happy to see where Bears is heading in ABI wellness. So thanks for joining us today.
Thanks for
And
having me, and looking forward to having you guys bring this into EASO in 2024. It's going to be a lot of fun, and you're going to help a lot of people.
absolutely. Awesome. Thank you, Sean.
Thank you.